Heart failure in infants, children, and adults. This is the congestive heart failure is a clinical state where there is inability of the heart to meet the metabolic demands of the body at normal physiologic venous pressures. The cardiac output, as we all know, equals the heart rate in stroke volume. The stroke volume is affected by afterload pressure, preload volume, or contractility intrinsic myocardial function. Causes of heart failure in pediatric patients can be cardiac causes like arrhythmias, structural heart disease, and myocardial dysfunction, either systolic or diastolic. Non-cardiac causes include those which increase the preload, like volume overload, afterload, like hypertension, or oxygen carrying capacity of the blood, like anemia, or increased demands, like sepsis. Cardiac causes of heart failure: arrhythmias, either tachyarrhythmias or bradyarrhythmias. Bradyarrhythmias like heart block or sinus node dysfunction. Tachyarrhythmias like SVT or ventricular tachycardia. Volume overload: structural heart defect اللي هو shunt cases like VSD, PDA, and other valvular regurgitation, mitral or aortic, or complex cardiac lesions. Pressure overload can be structural like aortic stenosis, aortic coarctation, or hypertension. Systolic ventricular dysfunction or failure in cases of dilated cardiomyopathy, myocarditis, malnutrition, or ischemia. Diastolic ventricular dysfunction in hypertrophic cardiomyopathy or restrictive cardiomyopathy, or pericardial effusion or tamponade. فوليوم اوفرلود اللي هو الفي اس دي بيبقى هاي شانت فبينكريز الكاردياك اوتبوت. Patent ductus arteriosus, same idea like the VSD. Pressure overload like coarctation of the aorta, like aortic stenosis, both volume and pressure. Hypoplastic left heart syndrome, في obstruction as well as high volume. Pathophysiology, congestive heart failure lead to release of renin-angiotensin aldosterone system stimulation, which cause increased contractility, selective peripheral vasoconstriction, salt and fluid retention, blood pressure maintenance. Chronic state of heart failure, increase in the heart rate and in contractility, and then the increase in myocardial oxygen demand, and then alteration in calcium homeostasis and hypertrophy of the muscle. That's a picture of the pathology. First, بيبقى فيه tachycardia, then thickening of the heart muscle, then dilatation and thinning. Signs and symptoms of heart failure: tachycardia, venous congestion, tender hepatomegaly, and for the right side or left side tachypnea. Low cardiac output, it is expressed as cool extremities, poor growth, dizziness, altered consciousness, and syncope. These are the heart failure symptoms: shortness of breath, edema lower limb, lack of energy and fatigue, difficulty in sleeping, orthopnea, swollen tender abdomen and because of the liver, loss of appetite because of the GIT congestion, cough with frothy sputum, increased urination at night, confusion or impaired memory. Presentation of heart failure in infants and children: it is the triad of tachycardia, tachypnea, and hepatomegaly. In infants, there's poor feeding, respiratory distress, poor weight gain, sweating. In older children, there is shortness of breath, easy fatigability, puffy eyelids, or swollen feet. Physical examination: tachycardia or gallop rhythm, weak thready pulse, cardiomegaly, increased sympathetic discharge, growth failure, cold, wet skin. Pulmonary venous congestion causes tachypnea, dyspnea on exertion, orthopnea, wheezing, and pulmonary crackles. Systemic venous congestion will result in hepatomegaly, puffy eyelids, distended neck veins, and edema. Manifestations of low cardiac output, fatigue or low energy, pallor, sweating, cool extremities, dizziness, mottled skin, decreased urine output, altered consciousness, and syncope sometimes. Compensated heart failure, congestive heart failure with normal cardiac output. Uncompensated congestive heart failure, low cardiac output. 4. Limb blood pressure is important to diagnose coarctation. There is lab workup, of course, chest X-ray, 12-lead ECG. There is cardiomegaly on chest X-ray. Maybe pulmonary congestion. We should exclude the thymus shadow in neonate. Absence of cardiomegaly in a good inspiratory film with diaphragm near the 10th rib posteriorly practically excludes congestive heart failure. Investigations. Congestive heart failure is not an echo diagnosis. The underlying etiology can be identified by detailed history and examination. Echo is indicating any child with unexplained congestive heart failure to identify potential cardiovascular causes, determine LV function, and serial evaluation of the efficiency of therapy. There is classification of heart failure. 1. Asymptomatic. 2. Mild tachypnea or diaphoresis with feeding in infants, dyspnea on exertion in older children. Stage 3. Marked tachypnea or diaphoresis with feeding in infants, prolonged feeding times with growth failure due to heart failure. In older children, marked dyspnea on examination. Grade 4 symptoms such as tachypnea, retraction, grunting, diaphoresis at rest. Lines of management. Treatment of the cause, of course, elimination precipitating factors, control of heart failure state. General measures. Cardiac chair or infant seat is used to relieve respiratory distress. Daily weight measurement is essential in hospitalized patients, usually not done, but it's very important. Predisposing factors such as fever, anemia, and infection. Treat underlying causes such as hypertension, arrhythmias, thyrotoxicosis, improve nutrition. Anemia aggravate congestive heart failure by increasing demand for cardiac output, so careful attention to iron store and blood transfusion if needed. Diuretics, furosemide, hydrochlorothiazide, and metolazone, a strong loop diuretic. In patients with physical findings of heart failure, a diuretic drug such as furosemide may be given before diagnostic testing is completed. A non-preload reduction agent. Afterload reduction agents such as ACE inhibitors, captopril, enalapril, and lisinopril. They should be treated at low doses and should be up titrated لأنه ممكن cause low blood pressure and low blood supply to the kidneys and have kidney complications. Inotropic agents, digoxin, oral, it's given no loading dose anymore. It's given as maintenance all the time, and it has a very narrow safety margin. In ICU, if the patient is very sick, we give dopamine, dobutamine, melrinone, اللي هو البريماكور, and recently levozemendan is a very good inotropic. طبعا heart lung machine, this is a ventricular assist device. This is the new devices that can be used to assist the function of the heart. And usually they are used as a bridge to heart transplant. What can be done to prevent heart failure? Prompt treatment of the underlying disease, زي thyrotoxicosis, anemia. Maintain a healthy body weight, maintain a healthy diet, including physical activity in everyday life and eating a diet designed to minimize heart disease. What are the long-term effects of the condition? If untreated, congestive heart failure in children will lead to early death. ممكن يبقى فيه permanent damage to organs if left even longer. Examination showed tachypnea, 50 per minute tachycardia. All pulsations are well felt. Temperature 39, blood pressure 120/70 in the upper limb. No difference in the lower limb. Chest X-ray في cardiomegaly. Examination, the apex of the fifth intercostal space outside the mid-clavicular line with gallop rhythm. Normal intensity of heart sounds, no audible murmur. Chest bilateral basal fine crepitations. Abdominal examination, hepatomegaly. Firm inconsistency, non-tender, non-pulsating, no ascites, no fullness of renal ganglions, no splenomegaly. Neurological examination today is free. However, there was that history of hemoparesis. Chest X-ray again, cardiomegaly, left axis deviation, left ventricular dilatation on ECG, and there's pulmonary venous congestion. What are possible diagnoses? Valvular lesion, shunt defect, pericardial effusion, myocardial disease. Myocardial disease زي cardiomyopathy, myocarditis, hypertensive heart failure. This is the 2D mode echocardiography showing dilated left ventricle and reduced ventricular function. Thrombus by echo, there was a thrombus in the LV cavity, and that can explain the hemiparesis. You can see here poor ventricular function and severe valvular regurg and cardiomegaly. So the diagnosis of this case is heart failure, secondary to myocardial disease with thrombus formation with emboli to the brain causing the hemoparesis, which improves quickly injured. Thank you.